Hi, my name is Gina Totten, and I'm going to talk about a current technology that is being utilized in my hospital system today. The current technology used in my organization is called iRounding. iRounding is an evidence-based practice used by leaders to improve safety outcomes, meet patient needs, and increase patient satisfaction. So how does iRounding work? Nursing leadership round on patients to ensure their comfort, safety, and satisfaction. They also round to keep them informed of how well staff is doing and provide recognition for what's going well. Its purpose is to ask about the overall experience the patient is having. It's more than just, "Hi, how are you, and is everything okay?" It's really about being present for the patient and building trust. This enables leadership to gather the important information that cannot be obtained by just sending patients a survey after their hospital stay. Effective rounding is done with a purpose. As we have all heard in real estate, location, location, location. iRounding can be thought as relationship, relationship, relationship. Patients will now have the ability to build trust in their healthcare providers, and hopefully this will raise patient satisfaction scores for the hospital and in the community. Nurse leaders each have an iPad to report their interactions with patients and families. As they round, patient responses are documented into our EMR, which is Sorian, through the iPad, and if a problem is identified, it is addressed in real time. For example, if there was a problem with the patient's diet or food service, it is possible to contact the kitchen staff immediately to address the problem. If the patient's room is too hot or too cold, environmental services can be contacted immediately to correct the problem. This is a new concept for the leadership in our organization. Nurse leaders may have gone into a patient's room if there was a report of a problem or issue that the staff could not resolve, but now leadership rounds on each patient on a daily basis. The problem isn't with the iRounding concept. It is usually with the availability of the iPad so that the real-time data can be collected and recorded during iRounding. The problem leadership is having is that sometimes the iPad is not available. It may be used for other purposes as well as rounding. It may not have been put back properly and so the battery isn't charged. It may even have been misplaced and the leader can't locate it to begin rounding. The practice of iRounding can be enhanced by placing an iPad in every hospital room for the staff and leadership to use. It would be placed on a dock in the room and would be for the use of only that patient in the room. This would end the problem of not being able to find the iPad not being charged, and the iPad being otherwise occupied. Target population. The target population is nursing leadership. They will be the ones who are rounding on each patient every day. Giving our nurse leaders easy-to-use iPad technology that is available to them when they enter a patient's room will allow them to sit and talk with the patients and build relationships with families and patients. The competition. Many local hospitals in the area are incorporating iRounding in their practice. Collecting real-time data and responding immediately to patients' needs is what increases patient experience. The Centers for Medicare and Medicaid Services, CMS, have made it clear that government reimbursements will be increasingly tied to scores that patients report after a hospital experience. CMS also posts scores on Medicare's Hospital Compare website for the public to view. Our organization's current practice has not been to round every patient every day. Now that this change in technology is occurring, leadership will be able to see every patient. The proposed product is the purchase of the additional iPads and docks for installation in each room. There are not enough iPads for rounding in the hospital. Additional equipment would need to be purchased and ready for use when needed. The cost, our finance department has estimated each iPad cost to be approximately $500 a piece. The chief financial officer in our organization has said that the cost will be minimal to the hospital system. The numbers are not official, however. The numbers do indicate that the cost will be between $5,000 and $10,000. Getting them docked in each room will take time for the IT and environment department, but this enhancement would benefit the patient and thus patient satisfaction. Implementation. This would be easy to implement since the leaders are already doing rounds but can't always get an iPad to use. The equipment will be readily available for use for each patient when the leader walks into the room. Policies and procedures. The beauty of the enhancement of eye rounding that I am proposing is that there would be no change in the current policy and procedures. This goal is very technically and financially feasible. The only change would be additional purchase of iPads and dock stations so that the information can be put into the system on a daily basis and can be retrieved and evaluated in real time. Efficacy. Eye rounding has certainly affected the level of care our patients receive. The patients are given the opportunity to speak with top management during their inpatient stay. It builds trust and levels of trust by demonstrating to patients and the organization's leaders that the organization's leaders are interested in the day-to-day processes and quality of the work that's being performed. The patients feel supported and are able to communicate their needs. Since timing is very important for daily rounding, it is important that the use of the iPad technology is available to leaders. By placing the iPad in every room, there would be no breakdown in the level of service received by the patient. Marketability. My market point to administration for the purchase of additional iPads and dock stations would be to assist the leaders to round on each patient and hopefully increase patient satisfaction scores. As previously mentioned, CMS will be reimbursing hospitals based on these scores. Having the availability of this technology in the hospital setting can only enhance patient satisfaction during their hospital stay. Thank you for listening, and I hope you have a wonderful day.